The doctor is in, and today it's Pediatrician Doctor Courtney Sauls from Ascension St. Pediatric and Adolescent Medicine. Today we're talking about eczema, a common skin condition, in kids that can flare up in the dry winter. Welcome in.
Hey, thanks for having me.
Merry Christmas, Happy New Year.
Thanks.
It's good to have you.
Yeah.
Well, eczema, I hear about it a lot.
Yeah.
How common is it? I guess, what is it, first of all, and how common is it?
Yeah, so it's very common, especially in our pediatric populations, our little babies, even toddlers and older kids. It is a condition of the skin barrier, and so we have a deficiency in a protein. Basically, your skin doesn't do its job very well, and it can get very irritated, itchy, rashy, and then causes this real red and dry rash. Most commonly in babies on the face and the kind of stomach and back of the body. Older kids, behind the knees, elbow creases, all of those areas can really flare up, get really painful and itchy and red.
What are some of the triggers for it? I mean, we talked about winter, the air.
Yeah, right now we're in the middle of it. So whenever the weather, the humidity of Tulsa, which is really nice in the summer for eczema, keeps it nice and moisturized. When we get that cold winter air, that can make eczema a lot worse because it's very dry and very cold. Kids being outside playing. Also, big triggers can be environmental triggers, allergens. Allergies are a very, very big trigger as well as if children have asthma, they're more likely to be prone to eczema. Also, it can be inherited. You can get it from your genetics, from your parents. That's very common we see as well.
Is there an age range besides obviously infants or babies that it can flare up?
Yeah, it can flare up at any time. A lot of times children will grow out of it when they get to school age, certainly by high school. Some individuals, though, it can be a lifelong skin condition, often managed by their regular doctor, sometimes by a dermatologist.
Now, we know you brought props.
I did.
Always brought props. What are some of the ways to treat it? Of course, parents are wondering, what do I do to help my kid?
Yeah, so the biggest key point, moisture, moisture, moisture. So that skin needs to be nice and moisturized with a really, really thick lotion or a cream. I brought some of my favorites here that I tell my parents to give. I really love this CeraVe brand. It is
it's my face wash.
Yeah, it's great. They have great products. They're very gentle to the skin. They don't have a lot of extra ingredients, but I love this moisturizing cream, specifically this one because it's very thick. It stays on the skin very nicely and gives that extra good thick barrier of moisture to the skin. Also, this Eucerin is really good too. It has it's called colloidal oatmeal in it. Oatmeal can be very healing to the skin. That's a great option. But sometimes these can be a little bit pricey for some families. You know what works just as well? A big tub of Vaseline. You can get a tub of the off-brand Vaseline, get you this big giant one, glob it on their skin. I always tell my families that you want your kid to look like a butterball turkey. Grease them up, have them really moisturized. If that alone doesn't work, you might need to try some steroid ointments. You can get over-the-counter hydrocortisone cream. That's a very light steroid. Use it twice a day. That can help the inflammation of the skin level. But sometimes you might need a prescription, and your pediatrician will be able to figure out what's right for your child. But here's an example of one of those. I use it for my son also. And then if you've tried all of those things and nothing has helped, you might need to see a dermatologist, or there might be some other things that you can try with your doctor. Sometimes even a superimposed bacteria infection you might need to take care of. So really definitely see your pediatrician if you've tried all of these things and it's just not helping.
Sometimes that's the case, but it's more common than people realize.
Oh yeah, and it can happen off and on. It's not a one and done thing for eczema, so definitely keep greasing your child up, making sure that skin is nice and moisturized, and see your pediatrician if it's not getting better.
Dr. Sauls, thank you so much for being here. We appreciate you as always.
Thank you.